Moloka'i is a very laid-back community and very cultural. We have Hawaiians, Filipinos, our majority of our people. And they really take their cultural beliefs and practices very serious. And I think it's really important because if you want to reach them, you have to respect their culture and their beliefs. That's the only way to gain their trust.
So in the Pu'uwai Native Hawaiian healthcare system, we serve the islands of Moloka'i and Lanai. Our main mission is to serve the Native Hawaiian population, through prevention. What that looks like is, we have clinical services, so cancer screenings, cardiovascular screenings, case management, as well as a behavioral health program. And through the behavioral health program, we have traditional mental health services, as well as behavioral health services such as chronic disease management, weight management, and our tobacco cessation program.
In 1988, the formation of the Native Hawaiian Health Improvement Act came about from Congress with all the studies done on Native Hawaiians. And at that time, they were starting to set up, through the act, health centers on each of the islands. And so Moloka'i, since we're already doing research, na Pu'uwai, which means the many hearts in Hawaiian, decided to take on the Native Hawaiian Healthcare Improvement Act. And so we became one of the 5 organizations set up throughout the state.
It's crucial to work, with the Native Hawaiian, Pacific Islander population and in rural communities. You don't have to necessarily be an expert of the culture, but you really have to understand the culture and where the people are coming from.
For Hawaiian to actually get services, they just need to be, we use the term ma'a, or they need to be comfortable to get those services.
On the first meeting with some individuals, they really won't say much of anything. So they really just sit there and stare at you because they don't feel comfortable. I remember one of the kapunas had asked me when I first started seeing her, she was asking me, what is your Moloka'i ties? And I had mentioned to her, my family is from Moloka'i originally, and that talking story around that really helped her to open up and start sharing with me what was really going on in her life.
It's always a social thing. Health becomes an outgrowth of that social network that we have. And again, getting back to our large extended Hawaiian families, it is a social network. You don't talk to people about health. You talk to them about other things that are familiar. It's just like a talk story session, You talk to them about your family, your mammals. Oh, your kids are grown up now. What are they doing? You say, that's the doorway to get into, let's talk about health. How are they doing on health? And then slowly you pull them into it. It's like a talk story session.